So many things do affect fertility. It's just wild. Even ibuprofen.
Yep. It's scary just because it's such a commonly used prescribed thing, over the counter thing. People take it like candy these days.
Yeah, you can buy it at Whole Foods.
Yeah, you
That's
can, but
crazy. It's like, come on,
I
guys.
don't think people realize like the effects of long-term use. Like having pain isn't a normal function of the body. And so rather than masking it, we need to look on ways to correct it. Otherwise, we're looking at this crazy road of kidney failure, liver failure, infertility, leaky gut, GI issues, acid reflux issues because you've worn out your stomach lining, etc. So it's a slippery slope, my friends.
Very slippery slope. So, and then the next step, like I was mentioning, you get the cortisone injections, and it's going to reduce swelling, but you're going to have an 8% loss of bone in 4 months. And so if you get three per year, almost a quarter of your bone is deteriorated. So your joint just starts accelerating in its degeneration.
I didn't know that. Doesn't it also affect your adrenal glands getting those injections?
Yep, it suppresses all of your, your sex hormones, especially your androgen hormones,
Wow.
get impacted. It can cause cataracts. We had a patient yesterday who, in a presentation that I was giving on stem cell therapy, and he said, "Wait a second, I got cataracts about 6 months after I got stem cell, or after I got
Not stem cell.
after I got the cortisone injections." And he's like, "Do you think it was from the cortisone?" I said, I don't know. I mean, you'd have to talk to your doctor about that, but I definitely think there was a correlation. I didn't want to throw his doctor under the bus because
Of course
that's
not.
the medical protocol, but yeah, I mean, a lot of us, we don't realize how dangerous this is. We've seen patients go into diabetic comas after they've gotten the steroidal injections too.
Wow.
One of my friends had a physician in his clinic in New York, and actually they were treating a nurse and did a steroidal injection. She went into a coma, still in a coma 7 days later.
Oh my goodness.
So yeah, crazy stuff. Elevated blood sugar. So once again, it's scary. Suppressed ability to fight infection.
Mm-hmm.
Not necessarily the safest. And if you look at it under a microscope, it almost looks like that person's knee looks like battery acid got injected into it.
Oh my gosh.
So once that treatment's done, then you move on to a knee replacement. And the knee replacements are very effective. They work in most people, well, at least half, but 50% or more need additional surgery. And over the years that I've been practicing, most people show up. They've wanted to get acupuncture treatments, they've wanted to get trigger point injections, all the cool therapies we do for their knees that have been replaced because they're still in pain.
Right. Because, I mean, really, that bionic joint is just fixing the joint. It's not actually repairing any of the tissue surrounding that area, like
Yep.
your ligaments and tendons and muscles. Like, so it's just so much more than just the knee you have to look at and like that mechanical piece.
Yep. Exactly. And so,
That's where it's
yeah,
healing.
sure, you took out the cartilage piece of it and the articulation, but yeah, you're right. You've got the tendons and all of the stabilizing factors. And the problem is it's very expensive. I mean, the average cost is $57,000. And so
Holy moly.
that's why a lot of, orthopedists are coming on to stem cell therapy, but there's still a vast majority who are, just still in that camp that they don't know enough about it. There's not enough research. And so I would argue that there's plenty of research, and stem cell therapy is much safer, a lot less expensive, and I mean,
A lot less.
lot
Yeah, the side effects.
side
If you just
effects.
leave that alone.
Yeah, and then there's the recovery time, 3 to 6 months minimum. Most people take about a year. So then we look at, okay, what's a better solution? Because we don't want you walking around in pain. We want your knees to function, because nothing's worse than laying in bed at night and you just got this achy knee that feels like someone's
Mhm.
tapping a hammer on it. Or how when your knees were at their worst, what was your pain experience
Oh
like?
my gosh, the night was the worst. So when it was late and I was trying to sleep, I noticed I would get really it would just ache internally, like deep in the bone, and then it would give me really bad restless leg. And so I was shifting around trying to be comfortable. I'd get pain all the way up through my IT bands, and it would just
Ew.
ache almost up into my hips because there's just so much inflammation, and it was miserable. Like, I wasn't sleeping well, I wasn't exercising well because there's things I just couldn't do anymore, like squats, and even riding a bike got hard for me at a certain point. So
Wow.
it's very debilitating. And like I said in an earlier podcast, we're so trained and conditioned to feel like pain is a normal thing, but it's
Mm-hmm.
not, and it can be avoided safely without prescription drugs and things like that. So
Yeah. Yeah, and I think this is, if you look at it with knees, this is the first structure to go out in our body. Our bodies deteriorate. First, our joints go out, and then it becomes our liver, and then it's our eyes, and then it's our brain, and then it's our heart. Or actually, it's our heart, then it's our brain. But so we got to protect our joints. But here's an alternative with stem cell therapy. I mean, here's what we've seen with our patients. You can see before this image to your left. This is a patient who came in with bone on bone, received the stem cell therapy. 6 months later, that's not perfect cartilage regrowth, but for a stage 4 osteoarthritis like that, that is significant because that's the difference between them playing tennis and golf versus not. And then this patient walking and enjoying hikes with his grandkids and not.
yeah, I mean, it was a huge victory because if you guys could see this image, I mean, you almost can't even see any gap between the bone and the knee, and then the new one. I mean, even what percentage rate, Reagan, would you say that is? Like,
The
of
cartilage
cartilage
regrowth,
regrowth?
that's about a 60%.
60%. I mean, from going basically from 0 to 60 after one injection, I mean, that is powerful medicine. And like, if he does another injection, what do you think he could even do more?
Oh yeah,
Yeah,
yeah. I think we
yeah,
could get that 80, 90%. And
yeah.
a lot of our patients, that's what they decide to do. We've had one patient he's been measuring his cartilage regrowth. He measured it first 6 months. He went to his orthopedist, and he got, and so it's going to keep growing. So
Yeah.
very exciting.
It's exciting because there's no downtime, and if you look at knee surgery, there's what, a 50% chance of something happening,
Yeah,
right?
exactly.
And then you look at a stage 4, one injection, no downtime, and this guy's at 60%. Like, those are pretty powerful statistics, if you
Yeah.
ask me.
Yeah, very powerful. And I mean, 60% of cartilage regrowth, but his range of motion's 100%.
Mm-hmm.
His pain levels are gone 100%. So I mean, in his mind, he's 100% healed, but we can see there's still some vulnerability in that knee. So one of the issues that one of the questions is, how can we regrow cartilage that's been damaged and lost? And so with the researchers, what they did is they took stem cells and they injected it into a knee with, you can see the medial side of the knee, the meniscus is gone. The other thing that's gone is the cartilage, good healthy cartilage. The medial side, you can see how it's thinning there.
Right.
And so at week 7, after they did the injections, you can see the cartilage is regrown. You can see almost about 30-40%. This particular patient by week 16, 80% cartilage regrowth.
Wow. It looks like a whole new knee.
Yeah, it is a whole new knee. I mean, everything's intact. Yeah.
Self-grown, right?
Self-grown, that's
Homegrown.
right. We like homegrown.
Yeah.
Another study with meniscal tears. The number one most common surgery in our country is the arthroscopic knee surgery. That's where people have some osteoarthritis that gets cleaned up, and then they have the slight meniscal tear.
Yep.
And so the researchers back in 2008, they injected stem cells in to repair the meniscus. They wanted to see, will it repair a meniscus that's been torn for several years, and will it be permanent? And so you can see in this first MRI where there is a complete tear, many tears in this meniscus. All those light areas that you can see, for those of you who are watching the YouTube, see the light areas where that meniscal tear happened. And then 2.5 years later, they took another image, and that meniscus is completely filled in. There's no issues. That meniscus had permanent healing for several years, which
this is really exciting news for. I recently got my knees injected, and on my left knee I had a slight meniscus tear, and it's been giving me grief forever, and I've been like, oh, I need to get surgery forever and just get it fixed. And our Reagan just said, nope, that you have another option. And so we did this, and it's been 5 weeks. I'm already at about 40 to 50% recovered, feeling better and stronger every day. My mobility's stronger. I'm going up and down stairs better. All those things. And it's just so exciting. And to know that, like, I avoided a very expensive, they might consider that a little more minor, but I don't want to go under anesthesia and put my body through that whole process. If I could just heal it myself, that seems like a way better avenue for me, and I'm already seeing the results.
Yeah. Yeah, no, I'm really excited to hear about your results too,
Yeah.
because I had my left knee injected November, and we had the best snowboarding season in Utah history,
Oh yeah.
arguably.
Oh
And
yeah.
so I was able to rally. My knee didn't bother me at all season long.
Mhm.
And if you look at the meniscal tear in their research, the New England Journal of Medicine released this in 2014. What they did is they took a group of, I think, two groups of 35 people. One group got what's called a sham surgery. Do you know what a sham surgery is?
I don't. Is that like investigational surgery? I don't know.
No, a sham surgery is where they'll cut the knee open as if
Mhm.
they were doing surgery, but the patient doesn't know if they got the surgery or not. And
Yeah.
then they take the other group, the control group, and they do the actual surgery on.
So it's like a placebo thing.
Exactly. They're trying to dupe the minds of the patients, which we can't remove the mind in healing no matter what you're doing, drugs or surgery. And what they found is the initial group that got the surgery outperformed the group that didn't receive the surgery for about the first 12 months. And then what happened is they started doing worse. Their knees accelerated at the degeneration because they took out the meniscus and cartilage. Even some of the damaged cartilage was still providing cushioning. And so the group that got the surgery actually underperformed the placebo group. So the placebo did better in this surgery, the most common surgery we do in our country that costs anywhere from $9,000 to $25,000.
Wow.
So pretty crazy, pretty earth-breaking. But in that same study, one of the men he was in a wheelchair before he got accepted into the group, and they gave him the sham surgery, and he didn't know. And they didn't tell him for several months later. They just wanted to see how they progressed, throughout the course of a year. And he was actually just weeks after, I think days after he got his meniscus repaired, he's up and walking, playing basketball with his son. And he thought this was a miracle surgery. It saved his life. And then you can watch this video if you just type it in on YouTube. You can watch the video of this boy playing basketball with this father playing basketball with his son. And this guy was like blown away. He did not believe him. He was like, there's no way. How can my knees work? And then all of a sudden he had like this spiritual awakening because he realized how powerful his mind was.
Wow. Yeah, I think we take the mind out of medicine too much these days, and that's where we're really missing the mark. Like the mind body connection, mind body spirit connection is so powerful. And maybe, just him thinking he got the surgery, like in his brain, this healing, beautiful healing process has happened. Maybe it stimulated his own stem cells
Yep.
to work harder and to heal him faster. And it's really cool.
Yeah, fascinating stuff. But, when we look at it, we do know stem cells work, placebo or no placebo.
Yes, they do.
It's incredible. And so here's another image you can see before.
Mm-hmm.
One of our patients is a load-bearing image, and the anterior part of her knee was bone on bone, stage 4. 6 months after, you can see a nice cushion had grown there. And we're just seeing this time and time again with knees. Knees are, if you want to play tennis, if you want to ride a bike, bikes are fairly easy on the knees. But even after they get bad enough, like you experienced, Annie,
Yeah.
you can't even ride a bike.
I can't. I couldn't do anything. And like we need our knees. Like our knees are that's what's keeping us going day in, day out. And that's probably why they wear out so fast.
Yeah.
Like we are workhorses in this culture. Like we just go, go, go. And I tell you what, I don't have time to stop and get, a $25,000 surgery and be down for 2 weeks and do all those things. I want to like continue to grow and enjoy my life and regenerate and do things naturally. And this has given me the opportunity to do that. It's so rad.
Yeah, beautiful. Yep. So for those of you who have knee issues, you want to get out of that pain, just give us a call. You can call us at 801-582-2011. You can also email us at info@gowellness.com. Visit our website, AccuEastWest.com. But we want to give you all the information, the data that you need. That's going to help you get, halfway there. But the other halfway is you need to come in for a consultation. Let us check out your knees, see if you're a candidate when you give us nothing to work with. But even in those cases, we're still seeing some pretty phenomenal results. So
Yes, we
Great things with knees. Hope this answered a lot of your questions. We had several people ask, well, can it help with meniscus? Does it help with osteoarthritis? What if you have cartilage on your patella that's degenerated? All those things we're seeing great response with. We've treated MCL, LCL, ACL. I mean, all of the cruciate ligaments and lateral collateral ligaments, and we've seen great results. So don't hesitate to call us at 801-582-2011 or email us at info. We hope that you will send this show to your friends, family, loved ones, and make sure to subscribe to us and give us a review. Let us know what you want to hear as well. Any last words, Annie, on knees?
Nope, just take care of them, and there's hope for you if you're hurting.
Yep, beautiful. Okay, there is, and Annie knows, and I know too. So have an incredible day, and we'll see you on the next show.